different ways to deliver radiation, and surgery is advancing. There's minimally invasive techniques. There's ways to let people avoid having an ostomy or a stoma bag long term. And specifically, I'll speak to rectal cancer. So, colon and rectal cancer sort of are, lumped together as colorectal cancer. The rectum is about the last 6 inches of your colon. And Dr. Kim and I work together to treat patients with rectal cancer. And rectal cancer can be tricky because it's down closer to the anus. Sometimes people need permanent colostomy bags. And the deal is that avoiding an operation is sometimes beneficial in these patients because of quality of life type of things. And there's some patients that we're actually able to cure of their rectal cancer, and I never even do surgery on them. So Dr. Kim and his team give the radiation, and then one of the medical oncologists give chemotherapy, and a certain percentage of people, the tumor will go completely away, and we have to keep a very close watch on them. But it used to be standard of care to just do a surgery on these people, and there's long-term consequences of that. We're really pushing the envelope here, and we have clinical trials that we're participating in, looking at potentially the non-operative management of rectal cancer.
We meet weekly and we discuss in our multidisciplinary tumor board. So our tumor board is a meeting of physicians, including clinicians such as radiation oncologists, surgeons, medical oncologists, and then radiologists, pathologists. And so we all put our minds together, review the films, the pathology slides, and then discuss what is the best treatment. And the reason this is so important is that not every patient is the same. In fact, they're all different, and there's different considerations to make. We certainly refer to the National Cancer Center guidelines, and then we also discuss potential clinical trials that are available as well. And so in this group meeting, this tumor board, that's when we put our brains together and figure out what the best treatment is for each individual.
People are being cured at higher rates. With the advances in chemotherapeutics and radiation and surgery, we're treating the patient better as a whole and as a group. And I think the important thing, like Dr. Kim mentioned before, is we're really trying to personalize the care for that patient. Some patients want to avoid a surgery at all costs and are willing to go through some other treatment methods to try and avoid that surgery, whereas other patients say, I'm not going to be able to sleep at night wondering and worrying about this. So other patients just want to have the surgery to have it out. So it becomes a complicated conversation, and I think that we do a nice job as a multidisciplinary group here at Siteman to discuss that with the patients and really personalize their care.